Welcome to the Insight series on personal well-being. Our question for this week is, what are some of the current major challenges to our health and well-being at the global level? Number 24. In thinking about the answer to this particular question, about what are those current major challenges to our health and well-being at the global level, I'd like to break them out into two major areas. First of all, the developed nations, which are oftentimes called the G20 nations. So there are 20 nations out of 200 nations on the globe that are really fully developed economies. And I'm going to go through each one of these, and one of the top concerns, I believe, will be long COVID and the reactions and the morbidity associated with COVID-19 infections. Secondly, mental health continues to be a major concern among the developed nations of the world. Climate change fear is pretty rampant in most cultures and most societies that are developed. Terrorism is still an issue for us, as we've seen more recently with the Hamas attacks on Israel. Primary care infrastructure and building strong primary care is one of those challenges for all of the G20 nations. Pandemic preparedness, which is the issue of what do we do in preparation for another COVID-like type of infection or pandemic. Infectious respiratory diseases, the flu, RSV viruses, echoviruses, a whole variety of respiratory illnesses. Cardiovascular diseases, and that's particularly associated with aging populations in affluent nations, which are oftentimes part of the developed nations of the world. Diabetes, which again is associated with the affluence of a culture and an economy. Obesity, some 2/3 of American adults are either overweight or obese. Road injuries, and that's really in economies where there are lots of vehicles, and there tends to be also injuries that occur from accidents with those vehicles. Dementia is part of our aging society, and particularly those G20 nations that have been developed for some time. Drug abuse and the use of both prescription drugs as well as illicit as well as legal drugs, but drug abuse is one of those issues as well. In the developed nation and developing nations of the world, I would probably identify the major current challenges as the effects of poverty, the terrorism events that have occurred throughout the African continent, particularly in Sudan and Eritrea and other parts of that area and region of the world. Long COVID is still going to be an issue in the developing nations as well. Mental health concerns, weak health system infrastructure. So this deals with how much primary, secondary, and tertiary care can be delivered to people across particularly rural areas of developing nations. Another one of the issues will be climate change effects. The developing nations, in my estimation, are less able to confront successfully many of the climate change related projected or theoretical changes occurring with climate change. Pandemic preparedness also affects those developing nations, although they're not quite as affected as the developing or developed nations because of the air traffic and a lot of the technologies that are in place. Infectious diseases in general, not just the respiratory diseases, but other diseases that deal with infection in those developing nations. HIV being one of them. Food distribution is more of an issue for the developing nations. Potable water, water that is good to drink and has no pathogens or has no parasites, that's an issue for many of the developing nations. Corruption is another issue in the developing nations as well, although it occurs in all nations, in my estimation. But corruption is more, in a sense, was more powerful because there's less wealth in many of these developing nations. So if that wealth is garnered by a few people and the privileged people, then that means that that corruption has much more serious and negative effect for the rest of the citizens. And tribalism would probably be one of the last areas that I would mention that I think is a threat in the developing nations. We saw that in Uganda with many of the things that took place around tribal warfare. So those are what I would consider to be major challenges, current major challenges at the global level. In summary, there are a number of major challenges to our health and well-being at the global level, just as there are at any country level. These specific challenges will require broad-based remedial actions in order to prevent their potential adverse effects on human health and well-being from occurring. For more information on this topic, you might try putting these terms into your web browser search engine. Global health challenges, current threats to global well-being, current world health and well-being problems. Next week, we will address the question, what are your major daily health-related choices? We encourage you to live well, live wise, live long.